Thank you. Welcome from Bangladesh team to the presentation of MAMI Care Pathway training methodology. So that's the overview that we will try to go through those things. That's our objectives, training materials, schedule, monitoring, evaluation, pedagogical approach, expected outcomes, recommendation, and some tools. We really like to see the worldwide. That's almost 45% of the children's the malnutrition is contributing factor for deaths under 5 years of children, and worldwide 20% of infants under 6 months suffer from malnutrition. And in Bangladesh and in Senegal, there's the underweight is respectively 15.9% and 10.4%. High quality care is a crucial here to prevent malnutrition. So with the purpose of to generate experience and evidence, London School from here has been selected one country in the Southeast Asia region, that is Bangladesh, that where LAMB is leading, and in West Africa, in Senegal, as IPS is leading the MAMI Care Pathway for this phase. I like to go directly to the objectives of the training. So MAMI Care Pathway, that's training of the trainers. The main objective was train a pool of trainers on MAMI Care Pathway so that they understand and can implement the MAMI Care Pathway and use of MAMI training materials. And then we also gone through that integrated management of childhood illness and MAMI Care Pathway training. The objective was master the steps of screening, assessment, enrollment support, and case management. And later on, that's orientation on screening, MAMI Care Pathway, that's using a case-based learning workbook, MAMI Care Pathway. It's to develop their skills to care for infants, their mothers, and families. The proactive screening and referral pathway establishment. I really like to go through some of the training materials that we have used. We use training manuals, step-by-step instructions for facilitators and also participants. And there were presentation slides and videos for covering key topics and concepts. And there we use flip charts. That's the MAMI counseling card and that we are calling booklet for quick reference tools, growth monitoring, and counseling for all of the health workers. And we also use measuring tools like weighting scales, MUAC tapes. We use standard MUAC tapes for infants and mother separately, and length board. And case studies, role play scenarios for practical experiences, skill, and with simulation doll. And record forms for documenting assessment, follow-ups, forms, training assessment, training evaluation, and enrollment. And lastly, handouts we have given as information sheets and for tips. Among those materials, I really like to go through a little bit about the simulation dolls. I would say that was the best attraction for the MAMI Care Pathway training. So the simulation doll, how that helps in our training. So we practice our case scenario through simulation doll, and we also practice kangaroo mother care. And also it highlights the inseparability of the mother-infant diet and acts as a powerful psychological bridge. As because with the simulation that was the empathy flashpoint for the participants, the shift to really, that's very realistic. And that also empowered the participants and increased their confidence and relief, as because they're using the dummy realistic plastic doll. So it reduces all the accidents that would happen around, that real baby if they are handling and there is something wrong. And also it builds the tactile empathy through delicate handling of the simulation doll. And lastly, the power of debrief. We have done after each training a debriefing of the participants and understanding and taking their feedbacks. So when they were debriefing, it was reflecting their emotion. They were better understanding why mothers are complaining, about their breastfeeding and how they are actually feeling while complaining, and how the participants can brings into account the mother's concern better way. And secondly, there was another attraction is that the training on relaxation. We also practice through video the progressive muscular relaxation. I really like to go through some of the quotation with three aspects. First, the physical sensations, the unconscious tension. That's one of the committee's field but attendance. She was saying expressing her feelings through. I felt a tingling sensation on my neck, and the tension headache I have had all morning completely vanished. And later on, someone was saying emotional and cognitive shift. That's one of the trainer from Lime Hospital. She was expressing her emotion like that. It felt like a physical reset button. I went from feeling hyper alert and anxious to feeling completely grounded. And then lastly, clinical epiphenes, that's the breastfeeding connections. One of the midwives, she was expressing very nicely is that now I truly understand why a stressed mother can't let down her milk. If my body felt that tight and restricted before the exercise, an anxious mother's body must be like locked up. So that's our simulation doll and the progressive muscular relaxation videos helps our participants to be feels very real, the training. And the roles and responsibilities of our trainers and the participants. The trainers were like preparation and the content of the MAMI Care Pathway, training management, and they were also responsible for learning and session facilitation and skill demonstration for learning for all the participants, and supervision in practices while they're going through that's all kinds of practices and the demos. And lastly, after training, that the trainer's responsibility is that monitoring and evaluation in the field, and they will also plan about the refresher and others steps if is there in barrier. And the participants' responsibility was the constructive engagement, that's active and meaningful participation throughout the training, peer learning and discussion. They were like openly discussing all of their practical experiences and collaborating discussion and experience sharing and inquiry. That was very open discussion and question answer session. They were all participating, and practical application of the skills, applying learned concepts through practical session. There, that's measurement of the walk and weight, and also the relaxation that they were practicing, and skill demonstration and practice that we expect from our participants after training, and also they have done in training. So hands-on practice and demonstration of key skills and techniques. So this is the pedagogical approach. We have tried to follow the MAMI Care Pathway, a layered learning and competency-based approach. So we have divided into four layers. So at the first layer, we have bring into that to understand more about MAMI Care Pathway, to know more for our cognitive foundation through our interactive lectures, core MAMI principles understanding, and disease classification that we have done through our IMCI training, and also our MAMI Care Pathway training of the trainers, and also the 3 days orientation to establishing essential knowledge and clinical understanding. Here comes the layer 2 is that simulated application, and that we have done through interactive skills practice stations that we were during the training we have done. We have done also role playing scenarios and case studies. There were like specifically 5 cases on different condition, like low birth weight of the baby or any breast condition from the mother. So those are the cases we have practiced, and also equipment practices that for the weight and the upper mid-upper circumference measurement we have used. So practicing skills and decision making in the safe environment while they will deliver the services. And in the layer 3, it's here comes the main clinical practice. Yeah, through that triage shadowing in the rapid screening in the waiting room and supervised diet assessment, mother and infant, like one unit, and counseling session with patients and treatment planning according to the WHO guideline, following the IMCI and other guidelines, applying learning to real world patients under direct supervision. And lastly, at the layer 4, we are actually focusing on the reflective mentorship for sustainability. It's basically after the training on the we will visit actually we are visiting on the field, so we are doing it on through on job coaching, and we are also planning for refresher session, peer review and feedback to our trainer, and we also like to do monthly data analysis, and if there are any barrier we immediately like to remove those. So we like to solidify the habits and continuous quality improvement through this approach. Here, I like to go very briefly training schedule that we were planning to do starting from MAMI Care Pathway, but later we understand that we have to do integrated management of childhood illness because most of their staff, the government and non-government, they were not getting this one. So we started with the integrated management of childhood illness for 5. The duration was 5 days, standard WHO competency-based course. Our audience was frontline health workers, nurses, medical assistants who handle general pediatric triage and under 5 case management. And strategically, we are focusing establishing the fundamental clinical baseline before layer building the specialized MAMI care pathway. And here come the MAMI care pathway, the 3-day orientation, and the target audience was clinical facility health workers, medical assistants, pediatric nurses, and also obstetric nurses, midwives. And strategically focused on deep dive operationalization of MAMI Care Pathway package for nutritionally at-risk infants under 6 months and their mother. And lastly, that's 1 day orientation for screening MAMI Care Pathway. Duration is 1 day, and the audience is at the root level, at the first contact, the community health workers, community health supervisors, and external NGO partners. And then strategically, we are focusing on field level healthcare providers responsible for the first point of contact and primary screening of mother-infant cares. This is some modules of the IMCI. It's the IMCI modules was we definitely follow the WHO guideline, but the 3 contents of IMCI we were focusing on to that's improving case management skill of the providers and improving health systems. That's the how the essential drug supplies and the use of availability and also use of equipment in the facility. And lastly, improving facility and the community practicing. Basically, that's the education of the parents on nutrition and where they can seek the help. So those are the modules. I will go very briefly. So first is that introduction of the IMCI principles, focusing on the general danger signs, cough, and difficulty for under 5 children. And then secondly, assess, clarify, and identify treatment for diarrhea, fever, and air problems in young infants and children. Thirdly, assess and classification of malnutrition and anemia using standard clinical indicators. And fourthly, that's identify appropriate treatments and to master caregiver counseling techniques for home care and feeding. And lastly, specialized focus on the sick young infants, local infection tracking, severe disease detection, and clinical management. This is for the MAMI Care Pathway. We are focusing specifically our 6 core contents. Those are relaxation therapy and kangaroo mother care, early childhood development, father and family support, referral to family planning services, complementary feeding, and crying and sleep pattern. So the modules were like 10 modules, and we use here that 3 days, total 5 cases. And beside those 5 cases, we try to give them understanding Why infants less than 6 months mature? Actually, that's the critical gap identification. And then rapid screening at triage, the importance of the anthropometrics clinical science, and maternal risk factors. And on the day two, we have tried to like comprehensive assessment of the mother-infant pair for breastfeeding mechanics, maternal depression, socioeconomic barriers, and progressive muscular relaxation video, and how they will conduct the counseling. And on the third day, we have included discharge criteria and establishing the community follow-up loop, and kangaroo mother care, and also that's breast condition counseling. So these are the modules for MAMI Care Pathway 3 days orientation. And lastly, this is the 1 day orientation. We were like focusing on that at the root level at the first contact. So that's community health workers, our main target. So the module was overview of the MAMI Care Pathway package, screening, comprehensive assessment of the mother-infant pair for breastfeeding mechanics, maternal depression, and referral capability. So the main contents was, to pick some of the contents from the MAMI Care Pathway in total. That's we try to give them understanding, our field workers, that the basic things, not at the deep level, but at least they understand the terminology. That's the first time they hear. So we have gone through the all the contents that I'm showing on the right side. That's breastfeeding, anthropometry, growth chart, weight measurement, PHQ-9, and all those things together. Actually, that's yesterday was the first batch that we have conducted, and I have seen that went very well. We will share very soon our learning. So after training, this here comes our responsibility. We really like to monitoring and evaluation, and we have started doing this one. So at the first level, we are evaluation, that's inputs and outputs, what we did right, that we were thinking to seeing that the percentage of clinical staff trained, and the availability of the MAMI tools like the cards, scales, MOAC tapes in the triage area. And we really like to look into MAMI program registers and hospital discharge data. And we are planning to do it monthly. And then short-term outcomes, are using this one? We really like to see it through that, reflecting on the percentage of infant under 6 months screened at triage, and the percentage of identified at risk mother infant pair enrolled in the MAMI Care Pathway. For this, we like to see into triage register and patient charts, and we're planning it to monthly or quarterly. And then long-term impacts, that is it saving lives, that we like to reflect on recovery or improvement rates of enrolled infants, reduction of rehospitalization rates, and maternal well-being scores. And we for this we like to see MAMI program registers and hospital discharge data again, and we are planning to do it annually. And shortly going to the stage of monitoring evaluation cycle that we are following in MAMI Care Pathway. Firstly, we like to see the screening. It's the measurement of infants under 6 months at the clinical entry point, at the triage point, that we like to do that. And then we want to go through the assessment evaluation, how accurately the trained staff assess maternal mental health, breastfeeding, and other they have learned from the counseling card. And then the main thing is that enrollment, tracking the successful referral loop between the maternal care and outpatient pediatric units. We really like to integrate that one. And lastly, follow-up and the care. So monitoring of the infant's recovery and maternal well-being in the community or in the outpatients level. So what do we really expect from this MAMI Care Pathway training? So we really expect that there will be proactive screening, implementation of the rapid triage tool for the early detection, who are the infants and the mothers at risk prior to clinical deterioration. That's our planning. And then we will like to see mother and infant as one unit diet-centric assessment. So the mother-infant pair as an interconnected unit we like to see, and there will be integrating infant nutritional metric with maternal health indicators. And the continuum of care is standardized cross-departmental referral. Some of those children will be coming contact in obstetric department, some will be in the pediatric department, and also there are other also post-cutting factors like nutrition, health, nutrition, and others. So we like to tracking and protocol to prevent our dropout from MAMI Care Pathway and capacitated delivery. If once our participants and our health workers, providers know their responsibility, so they will be and trained enough, they will be more enabling delivery of evidence-based counseling to the caregivers for better outcome. So we like to say some of the recommendations that we have learned through our training process. So while we were conducting MAMI Care Pathway first, so we have learned that the providers, the participants need to create baseline knowledge or basic understanding of infant health by integrated management of childhood illness for better understanding of MAMI Care Pathway. And the integrated maternal and child health in one health facility is the best for better outcome for maternal and children health, and ensure the health infrastructure feasibility within the existing healthcare delivery system for MAMI Care Pathway. Strong and lastly, strong functional referral pathway and sustainability. There are lots of referral system and mostly they are not functioning. So we really recommend a strong functional referral pathway for future sustainability. So these are the tools that we have used. I will go very briefly, that guiding principles. We all know that's the WHO 2023 and the global platform, that's the nutrition, clinical, and the social factors altogether they are considering. And there are lots of guidelines that already in our hands, and the booklet that we are using and being translated in French and in Bangla also. So we are using those as guiding principle for MAMI Care Pathway. And there are lots of forms like enrollment and follow-up forms. And we also use the videos for progressive muscular relaxation. And there is also a maternal mental health. That's we have PHQ-9, the patient health questionnaire through 9 questions. And there is the MAMI rapid screening for the trainers and also the participants that we have used. And lastly, the patient counseling card or booklet for the counseling that we'll print soon. So those all are the tools that we are using for MAMI Care Pathway training. These are some pictures from our, we already have conducted some of the trainings that you can see how actively they are engaging. Here is the reference. I really like to close with the MAMI vision. Every small and nutritionally at-risk infants under 6 months and their mother is supported to survive and thrive. Thank you so much, everyone.
Thank you so much, Dr. Monira, for such a wonderful overview and such a thorough overview of the training methodology. Very clear presentation. We really appreciate you presenting on that today. Before I pass over to our co-chair, Dr. Saha, to facilitate the Q&A discussion section, I just want to ask if anyone else from the Bangladesh team would like to add any thoughts or comments. I see Dr. Bushra, you're here, Bapon, welcome. I'm not sure if Stacy is here, but if anyone else would like to add anything additional before we go to the Q&A, please do just raise your hand or unmute your mic. No? Okay, great. Well, I'll pass to
Dr. Bapon. Hi. Yeah. Thank you. Just one thing. Today, actually, Dr. Aulo, who is chair of the technical working group of IP MAMI technical group, but most probably due to unavoidable reason, she is absent here. But we are happy that we have Dr. Hassan Bhai, actually, who is acting as a co-chair of our technical working group. I want to request to say something, Dr. Hassan Bhai, if he can say something on behalf of our chair. So I think it will be good.
Thank you. Am I audible? Can you hear me?
Yes, you are, yes.
Yeah, no, we
Okay.
can.
Yeah, thank you. Thank you very much. I think, thank you, Dr. Munira, for your excellent work and comprehensive, and I will say this is very well presented training module. Uh, I had just few reflection. Maybe your training package is already inbuilt there. Like, we would like to incorporate more case-based practical session in the training module, like for relactation, like for the case-based practical session for excessive crying babies, and also complete lactational failure cases, and also the mental health related issue of mother. So this kind of things, maybe I'm not sure you have already presented. There are certain things is there in your core component, but more practical session will be more helpful. And also the translated version, like we from the MAMI working group, we are thinking for preparing one training module, considering the new WHO, recommendation, and also incorporating with the child wasting. So where we are thinking to the prepared user-friendly job aids for the health service provider, especially for the community level, so that yeah, it will support them in decision making. So your work, your training materials will help us, because you have already shared that how it is working, and how it is actually the reflection of the your health worker and the community. At the same time, regarding the strengthening the continuum of care, this is obviously we have discussed in our technical working group several times. This is one of the things is always needed, but I saw in your presentation you provide a lot of emphasis on this continuum of care, and I'm not sure after the recover or after the 6 months, do your training package has also the linkage in between the other services, like for if a child is suffering from malnourished, either there is existing OTPTS safety service, or even in the everywhere in the working area there is the SAM corner, or we call is the nutrition rehabilitation center. However, it also need to be incorporated in the training manual. Otherwise, I think your training package will help us to also and many things can be incorporated, so we in terms of this national level training package will be very helpful for the technical working group, and also to scale up. Thank you.
Thank you so much, Dr. Hassan, for those reflections. Dr. Monira, I don't know if you wanted to respond, but I'll pass straight to Dr. Saba to facilitate this next section of our
Yeah,
meeting. Thank you.
yes, I really like to say something. Thank you so much, Hassan Bhai. It was really nice, that about the practical session. So I think we have included some of those, like your relaxation, excessive crying, complete lactational failure. I don't think that we have included this one, but this is very good idea. And the mental health condition, that's actually the guided our technical support given by London School of Hygiene and Tropical Medicine. So we are absolutely following that one. But I really like the practical cases that you have suggested. And I really like to answer your one question that you were concerned about, like after 6 months of infants, what will happen to them? Actually, really, that's also our concern, that you were talking about the outpatient therapeutic program, and there is like Sam Corner. So until now, this program, it's like research projects. So we are more into building our healthcare providers, their capacity, and not only for under 6 months. That we have given the IMCI training certificates. So this is not something that they will forget after this 6 months. So that will continue. So, but this is very good idea that you really like to concern about that after finishing this project, how they will continue. So it's a bigger thing at the policy level. I think the national level, they really like to look into that one, and that's why MAMI Care Pathway. That's where really tends to generate the experience and evidence. Thank you so much.